Good day, viewers at home. Welcome again to Families and Relationship YouTube channel. Today, we are talking about breastfeeding. How do you breastfeed, and what are the challenges and of breastfeeding? And we're going to sharing experience from Mrs. Adetitun here with us. She'll be sharing her experience on breastfeeding so that she can serve as a guide for you, and from there you can be able to learn. So, Mrs. Adetitun, I welcome you to tell me. Families and Relationship YouTube channel, and can you greet the viewers at home?
Good afternoon, everyone.
All right. So, as I said, today we're looking at breastfeeding. Um, the Federal Ministry of Health advises that children should be exclusively breastfed for 6 months or thereabout. What do you think about this from your experience? How easy is it to breastfeed a newborn child for 6 months at a stretch without any other thing added to the breast milk?
Well, breastfeeding is very, very good for the baby, for the
Speak up,
newborn,
please. Speak up, please.
and as they are going that's exclusive breastfeeding for 6 good months. Very, 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 very good. It helps the child. It makes the child grow well and healthy, and it makes them to be strong, and it prevents a lot of sickness and disease. Even when the child fell sick along the line, the breast milk will at least help the child, sustain the child. And sometimes when the baby falls sick or they are ill, most of them will not be able to eat their normal food, but because we are giving them enough milk, that's the breast milk, it will help the child, and it will sustain the child. Though it's not easy for good 6 months, and it depends on the child, one, then the mother, the type of job the mother is doing. So for that 6 months, it's very good for housewife, full housewife, yes, full housewife. Because when you are working, especially if you are working in a private setup, take for instance, maybe as a teacher in a private school. Most before, private school do give a newborn nursing mother maybe 4 months, 3 months, 6 months before. But recently, most of the private school, they reduce it to 1 month. So if you are a teacher and you are to resume, you are being given a maternity, is it maternity now, for 1 month, and you want to do exclusive breastfeeding, so definitely you have to take your child along, maybe in a school whereby they have crèche. So they will give you time, maybe after 2 hours, that's when you'll be able to breastfeed your child. So, and for those that are working with the government, it's like in Lagos, maybe they said it's 6 months or thereabout. Some government organization, it could be 6 months. So if you are at home with the baby, it's very fine, without adding any water for good 6 months. That is how we have been advised. But it depends on some
Factors.
factors. Take for instance, my firstborn, I was able to give her breast exclusive one for 5 months, 5 good months, without adding anything. Though most times she be crying, in fact I know she want to eat, but I know I just, it's not easy, because it's like baby that are big, they want to eat, they look at after about 2 months. To me, I discovered that the breast milk is not so enough, it's not enough, so to say, for them. But because it's healthy, it's good for them, it's good for their health and their development. So I closed my eyes, I made sure I tried as much as possible to give her for 5 good months. After 5 months, I bought a particular drink, ribena, So I was giving her for 1 month, including the breast milk. So it's not that I stopped the breast milk. I was giving her the breast milk every time. Then I was working, but at least maybe I was teaching then, so I still have time for her. So I after maybe about 3, I give her the Ribena maybe morning and night. So I was giving her morning and night. So every other time is a breast milk. So I was able to do that for 5 months. Then I included the Ribena. So before buying baby food for her. Then the second born, it was not easy. Though along the line, while giving my first child the breast milk, a lot of things. At times the nipple, you have issue. I have issue with my nipple then. Do you understand? So the pain and everything, because they are, though they don't, some of them don't have teeth until maybe 4 months or thereabout. But by the time they start having teeth, they will bite you. In fact, I can say that's one of the main reasons why some women they will say no. Apart from the fact that maybe they are busy or they are not always available. But some will say, the baby will be biting. Some will even say, no, they will not be satisfied, this and that. So, but for the first one, I was able to, to do it for a whole 5 months exclusively without any water, without anything. But my second born, I could not, because maybe because it's a boy, I find it difficult. In fact, sometimes if I give him, he will not want to take it. So I discovered that it was hungry. So I went to meet. I went for immunization one of the day like that. So I told the nurse. So the nurse asked me to go and meet one of the doctors. So I discussed with the man. So the man said, okay, since I discovered that he's hungry, that he will advise me to continue, that he's not hungry, that the breast milk is okay. But if I see that, I said he has been disturbing me. I know, I explained, I did everything. So he now said, okay, I should try and get something for him. So he told me a particular milk to buy for him, because he was not even up to 2 months then. So I bought the milk for him. He took it and he slept very well. So though he asked me to come back after buying the milk, I should come back and tell him. So when I went there, I told you that he slept so very well. Say, truly that means he's so bad. I shouldn't stop the breastfeeding. I should continue. So he now said I should time him. Maybe in the morning between this so time, I should give him breast milk. Then maybe after 2 hours, I should add the other milk, just to, just like addition. That I should not say because he's now taking that particular food, and I will now stop giving him. So I was able to do that, and it was okay. So, and some parents, I know when I had my last baby, I met a doctor that we put to bed at the same time. So we met in the hospital. She's a medical doctor. So we're now talking after maybe when my baby was 3 months or so. So we're now talking. So I now said that, so how is she coping with the breast? She said, that she stopped, that the milk stopped, the milk in her breast stopped. I was like, is it possible? She said, yes, that is not everybody. So I just want to discuss so that it's not everybody that, I don't know why, because I'm not a medical. So though she was able to explain some things with me that caused it, something like that. So she said even though they gave her a particular drug and like, but yet the milk was not coming out as it ought to. Though she said she took pap, she took in fact almost everything, but yet, in fact, she even made mention of her nipple, going inside. That she said whenever the milk, she's trying to breastfeed the baby, the nipple will enter. That she just got that the baby will be crying, and later she discovered that the nipple was going inside. That was why she couldn't, breastfeed the baby for maybe up to 2 months. So she just had to get baby food. So some people had that issue. Apart from maybe there's another health issue. So those are the reasons why some people could not. But I will advise all women to try as much as possible to do the exclusive breastfeeding. It will help their baby very well. The baby will grow well. It will help their brain, and it make them strong. At times when my baby they are still young, whenever they fall sick like that, they might not be able to eat other food, but that breast milk, I will make sure they take it, and it's helping. It has really been helpful. So I will encourage every woman to try as much as possible to do the exclusive breastfeeding. And even if you cannot do the exclusive breastfeeding for the whole 6 months, maybe because of any maybe reason that you cannot, just make sure you try as much as possible. Like my first born, I gave her breast even after she started eating normal food. She eats amala, she eats all sorts of food. I make sure I breastfed her for a year and 8 months. My second born, a year and 3 months, and because he's a boy, and it was my mother-in-law that said no, he's a boy, that's me, that I'm not fat, this and that, I should stop giving him breast. So I have to stop then. In fact, she collected him. Most times she'll be the one carrying. She say no, don't give it. So I have to stop. Then my third born, she stopped on her when she was a year 5 months or thereabout. She just stopped the something.
1 year and 5 months.
1 year and 5 months.
17 months.
But my baby, the last born, 2 years 2 weeks. If I remember when he was 2 years, so I went to, he was somehow strong, so I took him to the hospital. So the doctor was now asking that how old is he, and I said 2 years. He said yes, good. I was like good. I said it's not. He said yes, it's not easy, but I've done the right thing. That's 2 years. He was so happy. I was like So and
thank you for that.
So truly, it was not easy. In fact, before I could stop the breast, it was not easy. If I even recently was still bringing his mouth closer to, so I was like, so you've not forgotten. So it's not easy really, but it's very good. It's good for the baby, and it's also good for the woman. There is one of my neighbor, also. When she asked me, I said that my baby is 2 years. He was like, 2 years, that's good. So we're now talking. She now said, that's what she's using. The baby is around a year and 7 months or so. She now said that's what she's using as a family planning. I said, She said, a year and she said yes, that she has not been taking anything. That's normally she will breastfeed that child for 2 years, and that will serve as family. That's our own body because not everybody that can the system depends. That's our own system, or maybe the way our body is being structured. It works for her, but it might not work for some other people. So I was so surprised.
I think for family planning, people should consult their medical
doctor. But she said it worked for her.
Yeah.
So
now talking about breastfeeding, some people, the milk does not come out the way it should. So what can they do to make the milk to come out?
As I've said, and I told her about a medical doctor that said she had issue also, that the milk was not coming out as it ought to. Like I experienced similar something too then. So there was a time that, in fact, the first born, for about 3 to 4 days, after giving birth to her, the milk was not coming out. So my mother and my mother-in-law, in fact, there was a day my mother-in-law was like, I must finish that pap. So I was taking hot pap. Then her friend came in also. She said, it's not only hot pap, I should be taking amala and ewedu. Do you understand? So I started eating amala and ewedu. They will say I should eat plenty. And me, I'm not the type that I usually eat much. But she will say, after taking amala and ewedu, what's it called? Immediately I will drink 1 big cup of pap as water. So, and it's worked for me.
Okay, the milk started.
Yes, then in fact, they say that at times like this, when the baby is sucking one side, the other side too, we see the milk, gushing out and the like. So it works. In fact, it's very, very good for women.
Most women assume that when they breastfeed, most mothers or young mothers or new mothers, that when they breastfeed, the baby takes too much sucks too much, their breast will sag. What do you have to say to that? And they want their breast to be pointed.
Well, My grandmother, I know my grandmother, her breast was sagging too before she passed away. Also my mom breast too. So I know they tried also for us. So if you want to look at your breast being sagging, so it depends on, is it the breast that is sagging that you are after, or the child health? No, if your child is healthy and your breast is sagging, in fact I was reading something recently about it, because I also noticed recently that why am I, so I discovered that there are exercise that you can do, though it might not make the breast to be like when you were single, but at least it will adjust the something a bit. Do you understand? So I can't say much on the breast
So
sagging.
maybe
Or
those who are worried about the breast sagging can use bra.
you
They can use firm
definitely
bra.
use firm bra when but you can't be wearing it even when you are sleeping. Do you understand? So
Yeah, nobody is seeing them when they are sleeping, so
okay.
it doesn't matter at that
Then
point.
when you are going out, you wear bra, you dress smartly and the like when you are going out. But when you are at home, so that's breast sagging. To me, I don't know about others. And I will still do more research on how to make you as a lady, as a married woman that has children, and you are complaining of your breast sagging, we can do in order to at least to make the something a
The
bit
breast
firm.
to be firm, even despite the child
Yes,
sucking
yes,
the breast.
the breast.
Okay. So I know that some men also, husbands, fathers, they suck the breast of their wives, so to say. Now, when the woman is breastfeeding, is it advisable at that point? What do you think? What is your view
I
about that?
mean, with what you just said, I remember somebody that says once the wife put to bed, that I used to buy a lot of milk and tea, because there are two people that will be sucking the breast. The baby will be sucking, he also will be, well, if that is what the man wants, fine, I won't say anything about, I won't say no. If that is what you want and you yourself you are okay by it, there is no problem.
All right. I think with this, viewers, will come to the conclusion of this video today about breast milk. In the next one, we're going to be talking about the tightening of the vagina, or the healing of the vagina after childbirth. That is what we're going to discuss next after this. So if you have any question or comments on breastfeeding, breast milk, or um, any other question that relates to families and relationships, you can ask your question in the comment section below, and my wife and myself will come around to respond to your question. We thank you because you are there viewing this content, and we believe that you find it helpful. Our aim is to help you and to help everyone that are watching us by sharing some things that we believe everyone that is coming on the way that we have passed are going to be able to benefit from. So until next time, when we come again your way in the next video, this video that is spoken up by the side is the next you should go ahead and watch from this same channel of families and relationships. So until then, see you in the next one. Bye bye.